So as far as getting diagnosed, it is a journey. I'm going to just prepare you for that. If you're looking to get diagnosed with familial hemiplegic migraine, you've got a long road ahead of you. It's going to take a lot of effort on your part. It's going to take you taking charge of your medical care. And that's just what I learned. I thought I was just going to walk into the doctor, get a prescription, go home, and be all well. That is not the case with familial hemiplegic migraine. It's going to be life-changing, and it's going to take a lot to get diagnosed. Let me talk to you a little bit about how I got diagnosed. This is one case. It varies wildly based on where you are, what resources you have access to in order to get diagnosed, and how experienced the doctors that you're seeing are with FHM and with complex migraines. So it's going to be a long road. I started out with a local neurologist. I was in Charlotte, North Carolina. I'm going to give you the reference of the cities because the locality could potentially help some people, so I'll actually reference some people. So I started out in Charlotte, North Carolina, trying to get diagnosed. I went to the doctor. It took me 3 years to get a diagnosis, and I was lucky. So I started going out to a regular neurologist. I actually started with my internist, and he realized that this was more complex than he could actually handle. So he sent me on to a neurologist, and I went to actually several neurologists, I think probably 3. Different neurologists and different neurology practices to try to get diagnosed on this. I was put on every medication. They'll whip out this long list of 3 columns of all the medications they're going to try on you. I have been on everything to try to stop it. I have had 7 MRIs of my brain, 2 MRIs of my spine, 2 CAT scans, multiple EEGs, multiple sleep studies, a seizure study. I can't think. I mean, I've had so many tests it isn't even funny. I practically glow now. I've had so much done to me. So with that, they'll go through all the meds trying to find something that works for you. Typically, you'll go through all the meds and nothing will work. They won't find the magic combination on the standard migraine meds. So that's kind of another piece of the puzzle that leads them to believe that, okay, you're not like all the others. You might have something more complex. You might have FHM. You're going to go through a battery of tests, and you're going to get tested for everything. And you're going to go through a battery of medications, and you're going to be on every medication. So my biggest suggestion is find good doctors. And the way I learned that you have a good doctor is a doctor who's going to listen to you and believe you and try to help you, try to find out what's really wrong, get down to the crux of the issue, and not just kind of send you away with, oh, you've got migraines, or oh, you're whiny, or this or that or the other. As migraineurs, we can be whiny. Don't be whiny, but come in with a problem to solve. That's I think the biggest thing that I learned is don't come into a doctor and just try to lay out your entire spectrum of your disease at one moment. It's overwhelming to them and it's confusing to them. So go in with a specific problem that you want to solve, like I am in severe pain. I need to reduce my pain with my headaches. They will give you a scale of 1 to 10, how severe is your pain. With an FHM attack, it's going to be a 10. It feels like you're having a stroke. It is extremely painful. Birth was less painful. I'll just put it that way. It is extremely painful. Birth was a 7 for me after I had FHM, because FHM is a 10. So, and I've had a kidney stone as well. Yeah, kidney stone 7 again. Yeah, kidney stone's more like a 6 or 5. But you'll also develop a great pain tolerance as well with this disease. So. I was lucky in that I found one doctor. His name was Salil Manik, and I happened to walk into his office. He was actually from LA, getting ready to move back to LA. He was living in Charlotte, kind of hated it. I walked into his office and he immediately knew exactly what was wrong with me and suggested that I go to a palliative pain clinic. And we researched which palliative pain clinic I could go to, and I was sent to Duke University. So I was extremely lucky in that this man just walked into my life at the right moment, who was getting ready to leave Charlotte, and I got a diagnosis. I got the ability to get a diagnosis. I was sent to Duke University's palliative pain clinic and was able to get a diagnosis pretty much the same day. So I went to Dr. Timothy Collins. He was wonderful. I walked in, I told him my symptoms. He said basically it's 5 things. You either have MS, a brain tumor, you have a spinal tumor, you have familial hemiplegic migraine, or you have something we don't know what you have. I had already been tested for MS, I'd already been tested for a brain tumor, I'd already been tested for a spinal tumor. So we put me on the medications for familial hemiplegic migraine to try that, and if that didn't work, then I was going to come back and we were going to try to figure out what it was. So as luck would have it, it turned out to be familial hemiplegic migraine. So there is something worse than familial hemiplegic migraine. It's not knowing what your disease is. I think that's even harder than not knowing. So half the battle of any chronic illness is knowing what it is, and it relieves your mind. I mean, when you've got the possibilities of MS and brain tumor and spinal tumor roaming around, FHM seems like a win, a huge win, when it's all said and done. So I'll also say find a great internist. As having a genetic disease, this affects your biochemistry. You're going to have all kinds of other problems go on, and you're going to feel like you're collecting diseases, and I have collected a lot of diseases over time. So find a great internist that can really help you. I was lucky with William Burgess in Charlotte. He's an awesome doctor, and he was able to help me with all the other things that were going on besides what was going on with my FHM. So I'd suggest get a great internist. Another thing about getting a diagnosis is be a scientist. Go ahead and read all the things about FHM. Pick out what symptoms you do have. Be realistic if you don't have all those symptoms. I mean, if you're not having paralysis and you're not having stroke-like symptoms, you don't have familial hemiplegic migraine. You could have a basilar artery migraine. You could have all kinds of other kinds of migraines. But do your research, do your homework, become a scientist about your disease. Go ahead and study up and get to know everything about it. Also, I would say, again, I'd reiterate, identify your symptoms. Pick out what exactly it is that you have and what you don't have. And when you go to the doctor, be very clear about what you have and what problems you're trying to solve. It's kind of overwhelming for a doctor when you come at him with a bunch of stuff all at once. And if you are having more than one disease go on at the same time, it can be very confusing for you and for the doctor as to what's going on. So take a look at FHM, read the symptoms, pick out those symptoms that are FHM symptoms and work on those with your neurologist, and kind of let the others go to one side. So try approaching it, solve one problem at a time. Solve my pain problem, solve my problem with walking or frequency of attacks, or solve my seizures. Just kind of go at it one step at a time and be patient and just keep persevering. Don't give up until you feel better.